Okay, so have you ever looked at a prescription bottle and you're like, what is this word? What are all these letters?
Like hieroglyphics or something?
Totally right. And then you see those commercials on TV and they're like,
side effects.
Side effects may include this, and this. And you're like, oh my God, I don't even know what half of these things mean.
Right, exactly.
So today we are going deep into the world of medications.
Okay.
We are going to try to decode these medical mysteries.
I love it.
I am so excited about this.
Me too.
We are going to be focusing on the work of Dr. Khaled Hassan.
Oh, yeah. He's great.
He has this amazing podcast.
Yeah.
And he breaks down common medications.
I love that.
In such a clear way.
Yeah.
And we're going to be focusing specifically on medications that start with the letter L.
Okay.
So are you ready to dive in?
I am so ready.
All right, buckle up.
Let's.
So before we get started, I just want to remind everyone that medications often have two names. Like a generic name and a brand name.
Right.
So a really easy example of this is Tylenol. That's the brand name.
Right.
But acetaminophen is the generic.
Exactly. It's the same drug, just different names.
Exactly. So sometimes we'll be using the brand name, sometimes the generic name, but we're always talking about the same medication.
Okay, got it.
Okay, perfect. So first up, Lactulose.
Lactulose.
So if you struggle with constipation, this might be one that you've come across.
Right, or even hepatic encephalopathy.
Yeah, so tell me a little bit about hepatic encephalopathy.
Yeah, so tell me a little bit about hepatic encephalopathy.
And ammonia is elevated in people with liver problems.
Right, exactly.
Wow, so it's like a 2-for-1?
It is a 2-for-1.
That's fascinating.
Yeah.
Okay, so next up on the list, we have Lamotrigine.
Lamotrigine? Oh, this is a good one.
It is a good one. It's kind of a multitasker.
It is.
Because it's used to treat both seizures and bipolar disorder.
That's right. And I think it's so interesting how the same medication can be used for those two very different conditions.
Yeah, how does that even work?
Well, essentially, Lamotrigine works by stabilizing the electrical activity in the brain.
Okay.
So for people with seizures, it can help reduce the frequency and intensity of those seizures.
Okay.
And then for someone with bipolar disorder, it can help stabilize those mood swings.
Wow.
Yeah, it's pretty amazing.
It is amazing. It's like a little fine tuner.
Yeah.
Your brain.
Yeah, it's like a brain tuner.
I love that.
I love that too.
Okay, so moving on to another common ailment.
Okay.
Heartburn.
Ugh, I hate heartburn.
Me too. So Lansoprazole.
Lansoprazole, yeah.
A popular choice for tackling that burning sensation.
Absolutely. And this one belongs to a class of drugs called proton pump inhibitors, or PPIs.
Okay, so tell me how PPIs work.
They target a specific pump in the stomach that's responsible for producing acid.
So they're like little bouncers at the door of your stomach saying no more acid.
Yeah, they basically reduce the amount of acid in your stomach, and that's what provides relief from that heartburn.
That's awesome. So, if heartburn is a problem, Lansoprazole is there to help.
Exactly.
Okay, perfect. So we've talked about a couple different medications now.
Mm-hmm.
Let's talk about two that are often prescribed for seizures.
Okay.
We have Levetiracetam.
Levetiracetam.
And we talked about Lamotrigine earlier.
Yeah.
Now, both of these are used to treat seizures, but they work in different ways.
Right. So we already touched on how Lamotrigine stabilizes the electrical activity in the brain, but Levetiracetam actually works a little differently.
How so?
It's believed to prevent those abnormal electrical signals that cause seizures from spreading in the brain.
Oh, wow. That's interesting.
And this is super important because there are different types of seizures.
Right.
And doctors need to understand those differences to choose the right medication for each person.
So it's like having a toolbox with all these different tools.
Yeah.
Exactly.
Okay, so let's switch gears a little bit.
Okay.
And talk about a medication that's really important for managing Parkinson's disease.
Right.
Levodopa.
Levodopa.
So first of all, for anyone who might not be familiar with Parkinson's, can you give us a quick overview of what that condition is?
Sure. So Parkinson's disease is a neurological disorder that affects movement, and it often causes things like tremors, stiffness, and slowness of movement.
Right.
And that's where Levodopa comes in.
Okay.
So dopamine is a chemical messenger in the brain.
Right.
That plays a really vital role in movement control.
So if you don't have enough dopamine,
exactly,
you're going to have trouble moving.
Right. And in Parkinson's disease, there's a deficiency of dopamine.
So how does Levodopa help with that?
It's actually converted into dopamine in the brain.
Wow.
So it helps to replenish those depleted levels and improve the symptoms of Parkinson's.
So it's like giving your brain the ingredients it needs to make more dopamine.
Exactly. That's like a dopamine boost.
I love that. Okay, so we got Levodopa.
And then we also have Levodopa combos,
Yeah.
like Stalevo 50.
Right.
What is that all about?
So Stalevo 50 combines Levodopa with Carbidopa and Entacapone.
Wow, that's a mouthful.
It is a mouthful.
And those extra ingredients, why are they in there?
They basically help Levodopa work better and last longer.
So it's like a supercharged Levodopa.
Exactly.
I like it. Okay, so moving on to another very common medication,
Okay.
Levofloxacin.
Levofloxacin.
So this is an antibiotic
Yeah.
used to fight bacterial infections.
Right.
And it's important to remember that antibiotics are powerful,
Yeah,
but they also need to be used responsibly.
absolutely.
Because if we overuse antibiotics,
we can end up with antibiotic resistance.
exactly, which is a huge problem.
Yeah, it is a huge problem.
Because it means that the bacteria are no longer responding to the antibiotics.
Right. They become resistant and the infections become much harder to treat.
Exactly. So
Yeah.
it's really important to only use antibiotics when they're necessary.
Yes.
Yeah.
And as prescribed by a doctor.
Perfect.
Okay.
Okay, so moving on to something that I think a lot of people have probably experienced at some point in their lives,
Okay.
lidocaine.
Lidocaine.
So if you've ever been to the dentist and gotten a numbing injection,
Oh, yeah.
that was probably lidocaine.
Most likely.
So it's a local anesthetic,
Right.
which means it numbs the area where it's applied.
And it does that by blocking the pain signals from reaching your brain.
Wow.
It's pretty cool.
That is pretty cool.
Yeah.
So it's not just used in dentistry though, right?
No, it can also be used for minor surgical procedures to relieve pain from certain conditions.
Wow. So lidocaine is a very versatile medication.
It is very versatile.
I like it. Okay. So next up we have liraglutide.
Liraglutide.
And this one is interesting because it's used to manage type 2 diabetes,
Yeah,
but it can also help with weight loss.
it's true.
So how does it do both of those things?
So liraglutide mimics a hormone that we naturally have in our bodies called GLP-1.
Okay.
And GLP-1 helps regulate both blood sugar levels and appetite. So liraglutide can help people with type 2 diabetes manage their blood sugar.
Okay.
And it can also help people lose weight by reducing those hunger cues.
So it's like a 2-for-1 again.
It is.
That's awesome. Okay. So we've talked about medications for seizures. We've talked about medications for Parkinson's disease. Let's talk about ADHD.
Okay.
So lisdexamfetamine,
Lisdexamfetamine.
often prescribed for ADHD
Yeah.
to help people improve focus
Right.
and manage
Right.
impulsivity.
Exactly. And it does that by increasing the levels of certain neurotransmitters in the brain,
Okay.
like dopamine and norepinephrine.
Okay. And those are important
They
for
play a really important role in attention, executive function, and impulse control.
so it's like giving your brain that extra little boost in those areas.
It is.
I like it. Okay. So now let's talk about Lisinopril.
Lisinopril.
This is a medication that is often used to treat high blood pressure,
Yeah.
which is a major risk factor for,
Heart attacks.
yes,
Stokes.
exactly. So lisinopril is really important for managing heart health.
It is, and it belongs to a class of medications called ACE inhibitors.
Okay.
And it works by relaxing your blood vessels, which lowers blood pressure.
Okay.
And that makes it easier for your heart to pump blood effectively.
Okay.
It can also be used to treat heart failure and protect the kidneys in people with diabetes.
Wow. So many uses for lisinopril.
It's a busy little drug.
It is a busy little drug. I like it. Okay.
Yeah.
So let's shift gears a little bit
Okay.
and talk about a medication that's often prescribed for anxiety and sleep problems.
Okay.
Lorazepam.
Lorazepam. Yeah, that's a type of drug called a benzodiazepine.
Okay.
And benzodiazepines have calming effects on the brain and the nervous system.
Okay.
So lorazepam is often prescribed for short-term use to help manage anxiety and sleep issues.
But it's important to use it carefully, right?
Absolutely.
Why is that?
Because long-term use can lead to dependence.
So it's really important to follow your doctor's instructions.
Yeah, and to only use it as prescribed.
Perfect. Okay, so another combination medication
Okay.
that's used to treat high blood pressure,
Uh-huh.
the losartan hydrochlorothiazide combo.
Losartan hydrochlorothiazide combo.
I feel like we're getting really good at these drug names.
We are.
So this combo, how does it work?
Well, it tackles high blood pressure from two different angles.
Okay.
So losartan is an angiotensin II receptor blocker,
Okay.
which helps relax blood vessels.
Okay.
And hydrochlorothiazide is a diuretic, which
Okay.
helps remove excess fluid from the body.
So like a 1-2 punch
Exactly.
to lower blood pressure.
Right.
Very effective.
Very effective.
I like it.
Okay, so high cholesterol.
High cholesterol.
Lovastatin.
Levetiracetam.
So this one helps lower those LDL cholesterol levels,
That's right.
which are the bad cholesterol.
They are the bad cholesterol.
So how does lovastatin work?
It belongs to a group of medications called statins.
Okay.
And statins work by blocking an enzyme in the liver that's involved in cholesterol production.
Okay.
So basically, they're reducing the amount of cholesterol that your body makes. And why is it so important to lower LDL cholesterol?
Because high LDL cholesterol can lead to plaque buildup in the arteries,
Okay.
which can then increase your risk of heart attacks and strokes.
So keeping that LDL cholesterol in check.
It's super important for your heart health.
Exactly. Okay, so switching gears again,
Okay.
we have levothyroxine.
Levothyroxine.
This is a medication that is used to treat hypothyroidism,
Right.
which is a condition where the thyroid gland doesn't produce enough thyroid hormone.
Exactly. And thyroid hormone is super important for regulating metabolism and energy levels.
Okay.
So if you don't have enough thyroid hormone, you might experience things like fatigue, weight gain, and feeling cold all the time.
Good.
So levothyroxine is a synthetic form of thyroid hormone.
Okay.
So it basically replaces what's missing and helps alleviate those symptoms of hyperthyroidism.
It's amazing how medications can actually replace those missing hormones.
It is pretty amazing.
Okay, so our final medication for today.
Okay. Loxapine.
Now, this is a medication that's used to manage the symptoms of schizophrenia,
Yes.
which is a complex mental health condition.
It is a complex condition.
So can you tell us a little bit about schizophrenia and how loxapine helps?
Sure. So schizophrenia can involve a range of symptoms, including things like hallucinations, delusions, and disorganized thinking.
Okay.
And loxapine is classified as an antipsychotic medication.
Okay.
And it works by helping to regulate the balance of certain chemicals in the brain.
So it's helping to kind of restore that balance.
Exactly.
That's really interesting.
It is.
Wow. So we've covered a lot of medications today.
We have.
Starting a lot of medications today.
We have.
Starting with the letter L.
All those L
It's
medications.
been a journey
It has.
through the world of pharmaceuticals.
Yeah, I feel like I learned a lot.
Me too. So what are some key takeaways for you?
I think it's fascinating how many of these medications target the brain,
Yeah.
which really shows us just how complex the brain is. And it also highlights the incredible advancements that are happening in treating neurological and mental health conditions.
And it also shows that connection, right, between
Yeah.
physical health and mental health.
Absolutely. They're just so interconnected.
Yeah. What else stood out to you?
I think the variety of drug combinations that we talked about today
Yeah.
really shows how personalized medicine is becoming.
Right.
It's not a one-size-fits-all approach anymore.
No, it's not.
It's about finding the right treatment for each individual person.
Exactly. And that just emphasizes the importance of having open communication with your doctor
Absolutely.
so that you can find the treatment plan that is best for you.
Couldn't agree more.
So we've learned so much about these individual medications, but I think it also makes you wonder about the bigger picture.
Uh-huh.
You know, we've talked about how these medications can impact our physical and mental health, but have you ever thought about how they impact society as a whole?
That's a great question.
You know, like, how does the widespread use of these medications affect our healthcare system?
Yeah.
How does it affect our economy?
Right.
Does it affect our cultural perceptions of health and illness?
These are all really important questions to consider.
They are.
And I think it's something that we all need to be thinking about.
Absolutely. So as you continue your own deep dive into this topic,
Yeah,
keep those bigger picture questions in mind.
I will.
And I think that's a good place to wrap up for today.
Yeah, I think so too.
Thank you so much for joining me on this deep dive into the world of common medications.
Thanks for having me. This was great.
It was awesome. And until next time, stay curious.
And stay healthy.
Bye.
Bye.